Good evening and welcome everybody on behalf of the W. Montague Cobb Institute in conjunction with the U.S. Department of Health and Human Services. My name is Dr. Winston Price. I'm the Chief Technology and Information Officer for the W. Montague Cobb Institute. And this webinar is about helping individuals and being part of a major public health strategy. The Risk Less, Do More program is part of the U.S. Department of Health and Human Services Pan-Respiratory Virus Public Education Campaign. The public health campaign seeks to inform the public about influenza, COVID-19, and the respiratory syncytial virus vaccines. Campaign's main focus is to motivate a higher uptake of the flu, COVID-19, and RSV vaccines during this upcoming 24-25 season in hopes of reducing the public health burden of respiratory viruses, not only for individuals and families, but for communities and the nation as a whole. Additionally, the campaign will increase public confidence in the flu, COVID-19, and RSV vaccines. It'll help cultivate vaccine literacy and enhance our awareness of the vaccine accessibility, especially within vulnerable populations. Now, I am overly thrilled that this webinar will feature Dr. LAQUANDRA NESBITT, and we will be picking her brain. Dr. NESBITT is a seasoned physician and public health leader with a focus on health equity. She has an extensive experience leading initiatives to improve healthcare access and outcomes, particularly for marginalized communities. She currently serves as a senior associate dean and professor at the George Washington University, where she leads the Center for Population Health Sciences and Health Equity. Prior to that, she held leadership positions in the District of Columbia and Louisville Metro Departments of Health. Dr. NESBITT is a published author and has served on various boards and commissions related to public health and healthcare. Her bio is much more extensive than the brief that I gave, but I want to welcome Dr. NESBITT to the audience, and we will begin to probe her brain with a bunch of questions to help elucidate the issues. Welcome, Dr. NESBITT.
Hi, Dr. Price. Thanks for having me on this evening.
Thank you for joining us. So let's jump right into it. Of course, we've just, depending on who looks at it, just gotten over a pandemic. And so everyone's heightened awareness about the importance of a strong and solid public health structure to eliminate unnecessary death and morbidity is high in people's mind. But we know all of the struggles we had in getting the confidence for people to accept what has been the greatest public health strategy for the world, which is a very effective immunization and vaccine program. But we're coming to the 2024-25 season at a time when there's still some hesitancy and resistance, and also issues with regard to access to healthcare. And you've been a champion with regard to that for a number of years. And so we want to ask some questions that have come in from the audience with regard to how can we successfully improve the confidence and acceptance to the vaccines that we know will reduce the morbidity and mortality. And before I ask the first question, any opening statement that you want to make, Dr. NESBITT?
Yes, thank you for having me here today. And it's critically important that we give people the right information at the right time to be able to make the right decisions for themselves, their families, and our communities overall. We know that vaccines are safe and effective, and we know that vaccines save lives. We also know that there's a disproportionate impact of these, as you mentioned, these respiratory viruses that become more prominent or prevalent during the winter months. And now is such a critical time, the October, November timeframe for people to get these vaccines that will help keep them protected during the fall and winter months. And also, importantly, during these holiday seasons when we tend to gather and the risk of spreading these viruses become even higher, and our need to protect our loved ones, especially children, pregnant people, and our older adults become so critically important. So I'm just happy to have the opportunity to be with you this afternoon or evening and have this important conversation and share information about what we can do as a community to get the right information out there for people to be able to make the right decisions at this critical time.
Thank you. Thank you so much. And we talked about vulnerable population, and we know the learning experience, the hard lesson we learned with regard to COVID in terms of certain populations were more at risk in terms of having access to the life-saving vaccines and medical care. And among those vulnerable communities were the long-term care facilities. And so, considering the vulnerability of residents in long-term care facilities, what specific strategies can be implemented to ensure high vaccination rates among the staff in those facilities and the residents?
Yeah, so I'm glad you mentioned staff, because I was hoping that we have opportunity to talk about the two groups of people that are in long-term care facilities or that are important to reducing, these respiratory viruses in long-term care facilities. Oftentimes, we have the conversation be about the people who live in our long-term care facilities, like our skilled nursing homes and our assisted living communities. And that conversation is about the patients or the residents themselves. And they're an important group for us to focus on, right? Because they tend to be older adults. And if they're not older adults, they tend to be individuals who have a chronic health condition or immunocompromised, or may have a disability or limited mobility that increases their likelihood that they are not moving around or up and active a lot, and that they may have compromised lung health, and that acquiring a respiratory virus may increase their likelihood for hospitalization. And so it's really important that we get them access to vaccines such that if they were to get, flu, COVID, or RSV, respiratory syncytial virus, as you mentioned before, that they don't have a poor outcome from those viruses. But oftentimes, the way that those viruses enter into those facilities are through visitors or from the healthcare workers who are in those facilities. And so there are a couple of strategies that can be put in place to reduce that. Most public health is local, right? And so the policies that exist or the programs and initiatives that it will exist to keep people safe and healthy come from local public health or state public health. And many healthcare organizations or state and public health organizations have requirements that those healthcare workers may get the flu vaccine or COVID vaccine to help reduce the likelihood that those viruses are brought into those environments. And where they don't have a requirement, they highly encourage those healthcare workers to get those vaccinations, and they create easy access to those vaccinations, right? So providing them through employee programs, making them available in those healthcare facilities for the employees to access. And if they provide the insurance for their healthcare workers, then they make them available at low to no cost for their healthcare workers.
Okay.
The same things can be done for the residents who live in those communities. We, during COVID-19 in particular, and in other instances, found that many residents who live in long-term care facilities and their healthcare decision makers, whether they be guardians or just family members who help them make decisions about their healthcare, don't necessarily have vaccine hesitancy, right? They're not resistant to getting vaccines. No one's engaging them in the conversation about vaccines on an annual basis. And so when you provide that vaccine education, you remind them that these vaccines in particular have to be given for flu and COVID on an annual basis, or that you need your boosters, then they're receptive to them. The challenge then becomes, How do you make them available? And so there's opportunities to have partnerships with local pharmacies, and with healthcare providers who provide mobile vaccinations, to do partnerships with those long-term care facilities, to announce a date in advance when they will be on site. And then those healthcare decision makers and partnerships with the residents can help to make decisions about getting vaccinated. And so that was one way that we were able to really work with the long-term care facilities. And it's a strategy that can be put in place in big cities and small cities and rural towns, where you can partner with your local pharmacies, because pharmacists can actually give vaccines, to be able to come into those long-term care facilities and get everyone vaccinated in advance of the flu season and COVID-19 seasons, and make sure that everyone's protected.
Great, great, great. So the Montague Cobb Institute emphasizes building trust within communities. And trust is important because the trusted messenger is the one that's going to be more likely to get people to sway in the direction of getting and trusting the vaccine. And we know that healthcare providers, particularly physicians and nurses, are trusted individuals for accurate information. How can we effectively address vaccine hesitancy and misinformation specific to these long-term care settings?
Right. So, you know who we find to be good messengers, credible and trusted messengers? Relatives.
Okay.
They can get you to do things and they can get you to not do things, right?
Yes.
So your relatives, your community members, your faith leaders can be great messengers in getting people on board for these things, especially like vaccinations. And so having them be trusted community messengers and trusted brokers for vaccinations, and the closer they are in the particular age groups that you're trying to move to action, the better. So having young adults message to young adults, having older adults message to older adults, can be very highly effective strategies in terms of those credible messengers. So every year when you're moving your flu vaccine campaigns, you're getting your COVID boosters, you have people who you know are going to do it every year, messaging to other folks. And the same thing can happen whether we're talking about long-term care, whether we're talking about pregnant patients, whether we're talking about families who need to make decisions for their children, having those trusted messengers. The other thing that we know to be true is that while there's lots of discussion as to whether or not people trust, quote unquote, the government, so, the health director or the public health official, people tend to trust their local health director if they regardless of whether or not, they're trusting the federal government, right? They trust their local health director. They get to see them. They see them out in community. They see them at the local church. They see them at the grocery store. They tend to build a relationship with them. And they trust their own personal physician, right? This is a person that they're developing an intimate relationship with. They may, fuss with them a little bit when they're in their doctor's appointments, but ultimately they trust what they say. And so if we can equip the primary care providers, the cardiologists, the people that they see the most and get their information from, and ensure that they are actually reminding them. That's one of the things that we have to make sure is happening. The physicians see so many patients and they have so many things to remind the patients to do. If we can make sure that the physicians are reminding the patients every year to get your flu shots, to get your COVID boosters, the patients will actually do it. So there's still an extremely high level of trust between patients and their actual providers, the physicians, the nurse practitioners, the physician assistants. So that they are still really good, trusted messengers.
So true, so true. So beyond COVID-19, how can we improve routine vaccination efforts in the long-term care facilities to protect residents from other illnesses like influenza and pneumonia?
Yeah. So I'm glad you mentioned that, because we get very focused on COVID-19, but there's a lot of vaccines that older adults should have, and we want to make sure that they don't miss those opportunities, right? When you're rich 50, which is young, when you reach 50, you have to have your shingles vaccine. We know there's recommendation now, as you mentioned, for people to have RSV. We all know that people should have their COVID-19 boosters every year. But then there's also just, the pneumonia vaccine. If you're younger, younger people with chronic conditions, that unfortunately we know many Black or African Americans have, diabetes, chronic lung disease, or they may have had a transplant. They should get the pneumonia vaccine at an even younger age. But people definitely, by the time that you're 65, you want to make sure that you get the pneumonia or pneumococcal vaccine to prevent you from getting pneumonia. And though that for people who are in long-term care facilities, you would qualify for that just by being in a long-term care facility. So we want to make sure that people are understanding that and getting those vaccines as well. So those are things that are important to remember. There's also, the need to have the Tdap or a vaccine. We used to think that years ago you got that in childhood and you never needed to get it again, but now there's a need to have that booster with some frequency as well. So getting those things up to date, and long-term care facilities do a really good job because it's part of their being up to date and keeping up with the regulations related to up-to-date vaccines in those long-term care facilities, where we talk so much about the annual vaccines for influenza and COVID-19, because we want to make sure that they're keeping a focus on those in addition to the ones that you get, maybe once in your lifetime or, every 5 years or so.
Great. And expanding the ability for pharmacies and other ancillary health providers to be able to give the vaccine also increases the likelihood that vulnerable populations will have the vaccine. But we need to make we need to make sure that the distribution of the vaccine to rural communities and other at-risk pockets in the communities get the vaccines just as the big cities do. And so that's an important in the distribution.
Yeah, and those challenges have been mitigated. Less of a challenge than when when COVID-19, when we were in the throes of the pandemic, there were more vaccine access challenges than what we see now. And that had to do a lot with the initial formulations, and the requirements for storage were extremely onerous. I remember even in the District of Columbia, in the state of Maryland, the state of Virginia, here in the DMV region, when we were doing assessments around who and what healthcare facilities actually had these freezers that can maintain vaccine at these sub-zero temperatures. Not every acute care facility in the District of Columbia actually owned a freezer like this, right?
Yes.
And so that impacted the ability to distribute vaccine or store vaccine in particular healthcare facilities. And we are so small geographically that it allowed us on a daily basis, to be able to move vaccine around our jurisdiction. But you could imagine in a place like Texas, where you have those storage requirements, the ability to move vaccine around within 24 hours was severely limited, and limited a lot of access in rural communities, right? Now those storage requirements are not as onerous, and vaccine can be placed in rural communities. It can be placed in pharmacies. It can be placed and stored in a lot more places. And even the ordering process is not controlled so much by state health departments. So there's a lot more access to it. The other piece that you mentioned as well is going into the pandemic, we didn't have the degree by which certain providers, including pharmacists, could administer vaccines to people of certain ages. Prior to COVID-19, there were only, 18 and above, and only in certain states, and only with certain additional credentials. And now that has been lessened, where many states, people up as young as the age of 3 can be administered a vaccine by a pharmacist. And we know that in a lot of communities, rural communities and small cities with populations of, 50,000, 100,000, the pharmacist is really embedded in the community, serving like as an apothecary, as a community hub, providing a lot of information to people with chronic health conditions. They know them intimately as a core member of the healthcare team, and then being able to provide the actual shot or vaccine has been, life-changing in terms of access to care. And people aren't waiting to be able to schedule an appointment with their doctor's office to get the vaccine. They can just go to the pharmacy and be able to access it that way.
Great, 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 great. And certainly the digital support tools that are built into some of the electronic health records. You as an expert in population health, I'm sure you're looking intricately at the AI capabilities to forecast populations and pockets that are in need of vaccines and protection. And so hopefully that will also help us to focus better on those vulnerable populations ahead of the game.
Right. In lieu of waiting until after the flu season to find out who receives it,
Exactly.
we're able to predict, right, prior to. And as you know, there's a lot of farther penetration of the use of electronic health records and even SMS or text messaging. That even people, when we talk about the digital divide, we recognize that there still may be a divide in terms of where broadband access is in homes, but a lot of people are connected to SMS text messaging, including low income households, rural households have access to a phone that has SMS text messaging where they can receive a reminder to get the flu vaccine from their doctor's office, et cetera, or any vaccine that they aren't up to date with from their doctor's office. And that can, again, get them connected and reconnected to the healthcare system. Any point in the healthcare system, their doctor's office, the pharmacy, et cetera.
Great, great. And women's health certainly has been in the focus over the last several years and
Absolutely.
through this campaign. So let's talk a little bit about the focus on pregnancies and with the ongoing concerns about vaccine safety in pregnancy. How can we effectively communicate the benefits and the risks of COVID-19 vaccination to expectant mothers and their partners?
Yeah.
And how can healthcare providers effectively address these concerns to pregnant women who might have hesitancy about the safety of the vaccine for their unborn babies?
Yeah, pregnant people and their partners, they worry about two people, right? They worry about themselves, they worry about the fetus that is still developing inside of them, and we want them to have that concern, right? We would be concerned if they did not have that concern. And the important thing that I want to uplift as we talk about vaccine safety for pregnant people is to just remind people more broadly that vaccines are not developed overnight. Whatever vaccine that we're talking about, these vaccines are studied by scientists for years. Even with when we talk about SARS-CoV-2 or coronavirus, there are vaccines that were being studied for 10 plus 15 years, prior to the vaccine being manufactured and developed. And our scientists stay in a state of readiness so that when these emerging infectious diseases occur, we can bring a solution to the people that helps to save lives. And I think it's really important for people to understand that. And in the vaccine development process, it's a highly regulated process by the FDA. And when the vaccines are recommended for the population and the CDC gets, or the US Centers for Disease Control and Prevention, or the CDC, gets involved in that process, there's an entire group that gets involved to make sure that the vaccines are only going to be recommended for people in which there is safety has been proven and there's going to be a benefit to that group. And so once these vaccines, after they've gone through these multiple phases of clinical trials, and the vaccines are made available to the public, they're in what's called the phase 4 of the trial, which is continuing ongoing monitoring for side effects and for safety, and to make sure that the clinicians that are administering these vaccines are doing them in a safe way or using them as intended, and ongoing monitoring in multiple groups, which would include pregnant people. And based on the data that's been collected so far and the evidence that exists, there have not been any side effects or safety concerns for pregnant or breastfeeding people. And I think that is very important to uplift at this moment. And for the things that have been reported in pregnant people, they are not dissimilar from people who are not pregnant. And when I mention that, I'm talking about, the pain and swelling and redness at the site where the vaccine is given, or people reporting being tired after they've received the vaccine. And I'm talking about COVID-19 in particular here, being tired or having a headache or having the muscle pain, or having some chills after the vaccine, or fever or nausea. Those are the types of symptoms. They aren't dissimilar from non-pregnant people. So nothing unique presenting itself in the pregnant population, and nothing showing up in terms of congenital defects or anything showing up in the newborn that has been documented or of concern. So it's important for the providers who are providing care to pregnant patients to know, and we make sure that we recommend for pregnant people that they get the vaccine to protect themselves and their family. Now, there is, some important things to remember. Just like for pregnant people overall, pregnant people should not get live vaccines. So there are, the two types of the COVID vaccine that are recommended for pregnant people, and those are the mRNA vaccines that are marketed by Pfizer and Moderna, are the ones that are recommended for pregnant patients.
So other than participating in this wonderful webinar, what resources can healthcare providers utilize to stay up to date on the latest recommendations for COVID-19 vaccination during pregnancy and breastfeeding?
Yeah. So, the CDC remains still a great resource for healthcare providers. They still maintain up-to-date information, and they'll also keep any up-to-date, any new information, new science that evolves around the safety of vaccines for pregnant patients. And also the American College of Obstetricians and Gynecologists, or ACOG, has additional information for providers who provide care for pregnant patients, as well as the Society for Maternal Fetal Medicine, as well as the organization, the Trade Association for Reproductive Medicine as well. So those organizations, I have found, have always had the most up-to-date science around the safety of vaccines overall for pregnant patients. I find them to be a tremendous resource for healthcare providers.
Great. Appreciate that. And so at the other end of the spectrum, not talking about the infants, when we talk about the senior demographics, the rate of uptake of important vaccines like the flu vaccines is dismal. And even in the face of the greater challenges for seniors accessing healthcare and making sure that Medicare is bolstered so that they have access to primary care and preventive care, how can we improve vaccine accessibility for older adults who are on fixed income, and particularly those in rural communities who have mobility limitations?
Yeah. So can we start with the Medicare conversation? Because I think that's an important one. Yeah. So I don't want to make make assumptions about our listeners and what they know. And I find, having family members who have Medicare, that most of them don't know what their benefits are. And I think that also presents itself with some challenges in terms of people going for care, or they present it for something and they find that that's not covered in their Medicare benefit, and then they assume that other things won't be. But for people over 65 who qualify for Medicare, they have covered in their Medicare Part B, covers the flu vaccine, and it covers the COVID-19 vaccine, right? So that has no cost sharing for them, and they can access those vaccines. And the majority of their doctor's offices are storing those vaccines and have them available. And we find that even in most rural communities, those vaccines will be available in their doctor's offices now because the storage requirements have changed. And again, in pharmacies, they're available now as well. Now, when we talked about at the beginning, we know that there's a recommendation for RSV now because of the increased risk for hospitalization for people over 65 or people who have chronic conditions for RSV. That is not yet covered under Medicare Part B, but for people who may have a Medicare Part D plan, which has a prescription drug benefit, that RSV vaccine is often covered. So people can inquire about the level of coverage they have. If they have a Medicare Part D plan, then that RSV vaccine will likely be covered without cost sharing. So that's just, again, we're talking about the minimum, which is the coverage. Is it covered? Is it paid for? Well, and we won't have any cost sharing. Now we've got the issue of how do I get it? Is it in my doctor's office? Do they stock it? Is it at the local pharmacy? Will the pharmacy give me the injection? Those are other things. And as we've been talking a lot here, we know we're in the US. You've seen one community, right? They all look different. And we know, like, I'm in the Northeast. Baltimore looks different than DC. I've worked in both. I can vouch for that. And so, you have to be able to understand how to navigate those systems. And in some communities, the rideshare companies are still providing access or getting people connected to vaccines. Not in every city, but in some cities. And so being able to understand what's available to you in your community and having people through some of your senior centers, your senior community centers, faith-based organizations that have senior programs, how are they also helping us communicate this information about how seniors get vaccinated? I think that helps to close the loop quite a bit for seniors on an ongoing basis. We saw so many of those types of groups, like faith-based organizations that had, the senior breakfast on a weekly basis or a monthly basis, the community rec centers that had silver sneakers programs. Everybody wanted to help seniors get vaccinated. We had senior buddy programs where we had younger people who went knocking on doors, leaving their cell phone number for a senior to call them if they had any questions about the vaccine programs. We need those things every year. They shouldn't just be around for COVID during a pandemic. They should exist every year where we have people offering support to get seniors connected to resources to be able to ask a question. Seniors are savvy, but sometimes they need a little bit of assistance or they need a reminder. And those reminders should be there for them on an annual basis. And the same with transportation assistance to get some of these resources, whether you're in a rural community, an urban community, or a suburban community, being able to help seniors get connected. Sometimes it's offered through their Medicare or Medicaid program, sometimes it's not. But what are some of these, again, community-based organizations and programs who helped out during COVID, who can continue to help out now?
And that's why I'm so thrilled with the Risk Less, Do More program, because that's reaching to the community and making sure even communities where there is a higher prevalence of individuals who are unhoused, there are opportunities to get vaccine into the arms of individuals who otherwise would not have access. And then for your seniors who are not necessarily on the internet all the time, where they're getting their information and how do we combat that misinformation and build trust in the vaccine?
A good old door knocking. I mean, like, those are the things that we use during COVID-19 pandemic. Like, those are the meaningful tools that we have to remember to utilize all the time, right? We are a multi-generational society where all forms of media and communication have to be deployed. We can't rely only on social media as the form of way of transmitting information. We know that there are some people who watch the morning news, the noon news, the 4 p.m., 5 p.m., and 6 p.m. news, right? who read the neighborhood circular, right? Who
Mhm. Yeah.
will read anything you leave on their doorstep. So still using those forms of communication to get the right and accurate information to them pays a huge dividend. And we have to still use that as a way of communicating to them with the same degree of effort that we use to make a social media post, that we use for creating a YouTube video, or all of those things. We still have to be putting in efforts into those old things that worked before we had these new tools, because there's still a generation of people who use only those tools. And there's nothing wrong with that. It doesn't make us outdated. It makes us recognize that all forms of communication are effective for the various audiences that are out there.
Absolutely, those boots on the ground, and many of those seniors have underlying health conditions. You touched on the importance of making sure they get their COVID-19 vaccine. How important is it for them to get the boosters of the COVID-19 vaccine? Because some of them think COVID has gone away because they're not seeing it as often in their community. How do we get them to understand the importance of those booster shots?
Oh, it's extremely important because the type of virus that is circulating now, everybody was in what understood the term variants when we were talking about alpha and delta and omicron. Well, there are variants now that are different from those variants, right? Like, and what's in the vaccine now is addressing something different than what was in the vaccine that people got 2 years ago. So you need what is in the vaccine that is developed for this season to have protection this season. Okay. So if you have not received the vaccine for this season, you don't have the best protection because you need to be protected for this season. The vaccine that was formulated for now is based on what's been circulating earlier this year. Okay, so you need to go and get protected. You need a booster for protection for this season. What you received a couple years ago is not what's being given to people now. Okay, this is a new formulation to protect you for now.
Okay. Okay. And so the Montague Cobb Institute also emphasizes racial and ethnic health disparities. And so discussing specific challenges faced by minority communities regarding vaccine access and hesitancy. A lot of it is based on things that happened many, many years ago. And certainly the health department, Health and Human Services, CDC, public health departments are not those biased and wayside things that happen in terms of inappropriate testing and research. So how do we dispel some of those misgivings with regard to what happened 40, 50, 60 years ago to get the confidence in not only the senior population, but in minority communities about the safety of these vaccines?
Yeah. So, again, I want to emphasize that the research that is done for vaccines now is done in an environment where people consent to participate, that there are institutional review boards where there is a degree of transparency around what happens in a research study, what happens in a clinical trial, and people only voluntarily participate with high degrees of transparency. And there are multiple phases in that process where safety is the primary concern when these vaccines are tested. And then the number of people who are participating in that trial increases during the first phase, the second phase, and the third phase of those trials. And they only move through the process if there is a benefit. And trials are stopped if the benefits are so great that people who are not receiving, they say call it the sugar pill, the placebo. If people are receiving a placebo instead of the vaccine, but the benefits of the vaccine are so great, they give the vaccine to everyone, right? So there is such a degree of integrity in these processes now, and people are consented now, in a way that did not happen 40, 50 years ago, when communities of color, African American communities, indigenous people were put into trials without their consent. That does not happen in this modern age and era. And we've seen ownership for the things that have happened in the past. The other thing that I want to call recognition to is that we're seeing these vaccines be widely distributed. There is not a disproportionate placement of vaccine in communities of color, and that should provide us some confidence in that the vaccines are safe and they're safe for everyone, and that we must take care of ourselves and ensure that we are doing the right things to protect ourselves from these viruses that we know disproportionately cause in the communities of color that are already having chronic diseases, that when you're infected with these viruses, your risk of becoming severely ill and hospitalized is higher. Okay, so if you don't protect yourselves with these vaccines, you're more likely to have a poorer outcome. And so it's incumbent upon us to take care of ourselves, to get vaccinated so that we stop dying sooner than everyone else, that we stop having higher rates of hospitalization for things that we know we could have done something to prevent it. And I think that's an important message that we really need to uplift, right? These are vaccine preventable illnesses. These are vaccine preventable viruses. And for our community that has diabetes, chronic lung disease like COPD and asthma, we could actually get these vaccines and reduce our risk of hospitalization and death from these viruses. And I think it's important that we do so.
Yes, I'm hearing you. So one of the other aspects is related to the fact that we're having more people of color in these clinical trials, and so getting the message to them that the vaccine is effective in our population as well as the other risk group populations is an important message to be able to give. And certainly NIH is making inroads in terms of trying to make sure that there's equal representation in the NIH studies, similar to the numbers we're getting in the All of Us research program.
Correct. All of Us has been an important driver on eliminating disparities in clinical trials, and the selection of the sites for where clinical trials were happening for COVID-19, influenza research, and on other topics like HIV-related research, cancer research, a host of other types of research has really been monumental in trying to recognize that we don't have a homogeneous population here in the United States. We have to have diversity in our clinical trials, such that we recognize that even though race is not a biological construct, it's a social construct, we have a better understanding in which in how these drugs will work in a more diverse population than what has happened in the past with some of these studies that were typically done in a white 60-year-old man that weighed 150 pounds, right? We are doing a better job of enrolling people who identify as Black. We're doing a better job of enrolling women in these clinical trials. We're doing a better job of enrolling people from various countries who live in different social contexts. All of those things to better understand how these drugs, vaccines, et cetera, will work in the real world.
The public health infrastructure of America. What are your insights on the long-term public health strategy for COVID-19 and other potential preventable diseases, including the potential for making some of these vaccines mandatory vaccines? Because we know that the uptake for the required vaccines is better than the ones that are considered voluntary.
Yeah, so that's going to be on a state by state basis, right? And
Yes.
vaccine requirements have always been left to the states to decide. And I think you've been watching, like I've been watching, that state policies have been eroding around vaccine requirements. And it's been challenging to watch. We know that school entry laws for the K through 12 population has had one of the most significant impacts on reducing vaccine preventable illnesses like measles, polio, things that many people in their 20s or 30s have never seen in their entire lifetime. And now we're starting to see a
Mhm.
resurgence of those vaccine preventable illnesses here in the US. In the last couple of years alone, we've seen a few measles outbreaks because some states have started to reduce either the enforcement of their vaccine requirements or to repeal them altogether. um, One could only hope that the public who supports the reduction of the enforcement of these laws or the repeal of these enforcement laws would take notice and recognize that this is actually harmful to children and harmful to the public at large, and would lessen their advocacy for such, or that we could place political leaders in positions of power that would stop these efforts or stop moving these efforts forward. Um, Conversely, in the jurisdictions where we are not seeing this, I think those jurisdictions are going to make very wise decisions in terms of where they can be more strategic in terms of revisiting and adding to the requirements for not only school entry laws, but what other places that we can have vaccine requirements that continue to protect the public's health.
Mm.
I mean, the vaccines have added more to life expectancy. Vaccines, clean water, urban planning laws have added more to life expectancy than some of these medical technology advances that people clamor to get to, that add an additional 2 to 3 years to your life
Right.
when you access them. Yeah.
Right. And we certainly learned from the pandemic that what happens on other shores across the globe can impact the health in our communities. So, how can we promote international cooperation and collaboration to address some of the vaccine equities? Because we certainly know that certain countries did not have the same access and resource to vaccine protection, although some of the countries in Africa were able to develop their own vaccine. But how can we assure that there's equity across the globe when there are um, global pandemics such as this?
Yeah, so global health security is extremely important. And, these emerging health threats demonstrate this to us time and time again. One of the programs that has come to mind when we have this conversation, it comes to mind all time and time again, and is, I hear talk that it's under threat, is PEPFAR. Are you familiar with PEPFAR? I think some people are. It's one of the initiatives of the US government
Yeah.
that has done a lot of
Mhm.
work to provide aid and access to medications, research, and other resources to respond to the HIV epidemic in Africa. And recognizing that, again, we live in a global society, and what we do to support another nation, another continent, has a significant impact on the health of our own society, because again, we're global. And we recognize that again, when we talk about whether it's whether we talk about whether or not it's Ebola, whether or not we talk about it's Mpox, all of these things are one plane ride away, right? And so our ability to provide mitigation strategies once they're available in the US, whether it's sharing knowledge, whether it's sharing resources, whether it's sharing vaccine, whatever it might be, only helps secure the health of our own nation. And so you mentioned Africa, but we also have the same need to provide support to the Caribbean. We have the need to provide the same support to many of our other countries and nations that are intimately connected to the U.S., where we're a global nation that has high degree of sharing, transport, human resources, et cetera, and we have to think about how we secure, again, global health security for a host of other reasons.
And we talk about vaccine efficacy and safety, and the need to ramp up vaccines on short notice when there are these novel viruses. And certainly we've seen, probably over the last 6 years or so, more and more shortages of key components in our society. I mean, we tout ourselves as being the great nation in the world, but to have shortage on formula and IV solutions and certain medications. So how can we assure that we are prepared for the next pandemic, that we will be able to not only support ourselves, but also this global environment?
Yeah, I mean, our entire supply chain that props up whether we're talking about our healthcare system or our public health system, really needs to have some reimagining. If you think about the initial public health response and healthcare response for COVID-19, we had to limit healthcare services in a number of domains because of our personal protective equipment supply chain. So surgeries had to be limited because the personal protective equipment had to be used by the medical units. And you would think that in the US, we would have the capacity to continue to produce, or would have readily available sufficient personal protective equipment to continue to, function our entire healthcare delivery system. The other things were, as a public health and healthcare system, we were having conversations amongst ourselves about the movement of ventilators across the country, such that only one region of the country at a time could be experiencing a surge, because the number of ventilators across the country were not sufficient to support a large number of people with the need of intensive care. And then the sourcing of these ventilators, and not every ventilator is compatible with every healthcare delivery system in the country because of the technology. And so we have got to do a much better job of ensuring that our medical supply chain, whether it's the durable equipment or the non-durable medical equipment, we have to make sure that we don't fall flat in the next public health emergency. There has got to be either a reimagining of how we manufacture these supplies here in the US, where we have a stockpile of things and how long that stockpile is expected to last us, as opposed to thinking that medical emergencies in the US are only going to happen in one state or one jurisdiction at a time, and that all of the resources will go there, and then we have a period of time to rebuild our resources. I mean, and we obviously didn't learn our lesson from that, because here we have a hurricane in North Carolina, and now we don't have sufficient IV fluid across the nation to keep our entire healthcare system operating.
That is the case. Well, this has been a phenomenal journey with you, Dr. Nesbitt. I can't believe the hour has rushed by so quickly. You provided us with a wealth of information with regard to the importance of a sound public health strategy to eliminate unnecessary risks from a number of disorders, but particularly the focus of the Risk Less and Do More campaign to prevent disparities and unnecessary death and morbidity related to influenza, COVID-19, and RSV vaccine hesitancy and disparities. Again, this campaign aims to motivate a higher uptake of these vaccines during the 24-25 season and really set the structure for the life's work that Dr. Nesbitt has been doing to elevate the public health strategies and the population health focus that we need, not only for America, but across the globe. And so any last 2-minute comments would be appreciated by you, Dr. Nesbitt, but thank you again for all of your intellect and fervor with regard to this campaign.
No, I just want to thank you all at blackdoctor.org and at the Cobb Institute for hosting such an important conversation and making sure that we get accurate and timely information out to our community. As we move into this season where we know these respiratory and viruses are going to increase, we want to make sure that everyone gets the vaccines that they need, and more importantly, that we're protecting our older adults, those who live in long-term care facilities, that are pregnant and expectant mothers have the information they need to keep themselves and their soon-to-be babies protected, and that our parents of small children are making the wise choices to make sure that they get their vaccines as well. And as we move into this holiday season, that we're making the right choices for ourselves, but also our families and loved ones in their community. So I look forward to all of our physicians, our Black doctors, helping to get that information out to their patients and having a healthy and prosperous season.
Thank you so much. And to our audience, risk less, do more, give vaccine as a holiday gift, and get your relatives, friends, and community to put their arm out. Thank you so much.
All right, be well.
Good night.